This is the spine model, which is showing spine, whole of the spine and the pelvis. So today let us discuss about the lumbar disc prolapse. Basically disc prolapse in the spine. So commonest area of the disc prolapse is in the lumbar region. This is the last 5 vertebra. This is the lumbar region. So commonest disc prolapse is seen in this area. You can also see disc prolapse in the cervical region also. This is the upper 7 vertebra, that is cervical vertebra. So you can see body, the white thing is the body, and the translucent area between the two body that you see here, that is the disc. So this is body, this is disc, this is again body, this is disc, and now you are seeing it from the anterior side, front side, and this is the back portion of it, back side of the spine. What you see here on the either side, that is the yellow part, that is the root, which in other ways you can call it as a nervus. So all these nerves come out from the spinal cord and supply either hand, upper part it supplies the hand, middle part it supplies the thorax and abdomen, and the lower part it goes out and supplies the lower limb. So whenever there is problem in the lumbar spine is the commonest area where you get the disc prolapse, because this is the maximum movement takes place in this area. And the another area you can commonly see the disc prolapse is in the cervical region. Here again you see the common movement, most common moving area of the spine. Whereas thoracic part is more or less it's rigid, so that's why you don't see much problem in the thoracic area of the spine. So disc prolapse is either you see here in this area or in this region. So whenever there is disc prolapse, disc always disc is supported by the ligaments from the front, from the side, and there are also ligament in the back also. So overall it supports the disc so that it prevents disc from coming out of its space. So whenever the disc comes out of the space, so it can compress this root. This is the right side root and this is the left side root. If there is herniation from the left side, then it will compress the left side root. If there is herniation from the right side, it will compress the right side root. So patient will have symptoms depending upon which root is compressed. If it's the first lumbar root is compressed, then patient will have pain in the area of upper thigh. Same in number 2, that is lumbar second nerve is compressed, then patient will have pain near the knee. Same in lumbar third root, that is L3. If that is compressed, then patient will have again just below the knee, there will be pain. Same way fifth or fourth root, fifth root is compressed, then patient will have pain in the foot, in the toes. So depending upon which root is compressed, patient will have symptoms. Back pain will always be there, whichever the disc is prolapsed, but leg pain depends upon which root is compressed, patient will have the symptoms. So then coming to the treatment. So most of the time, if the disc prolapse is very severe and significant, and if it does not improve with the medicines, then you have to consider surgery for this, because surgery is the final solution for all disc prolapse cases. So once disc is prolapsed, it is a useless disc, it is already a damaged disc. So there is no point in carrying life with the same disc for whole life. There is no point. So what you have to do is you have to remove this whole disc and replace it with the artificial disc, and then you fix it with the screws on either side. Pass the screw through the pedicle and then to the body. Same way on the other side also, pass the pedicle screw then to the body, and then again whichever root you want to fix or whichever body you want to fix, then again the same thing has to be repeated in another vertebral body, and then both the side you fix it with the rods. Then that whole area becomes single column, and movement will not take in between, so that root will not be compressed again. So the surgery is very simple. Remove the disc, put an artificial disc, and fix it with on both the side with the screw and the rods. And this can be done with a minimal invasive surgery also, where incision will be very small, and put an endoscope and remove the disc, and percutaneously you can pass the screw and fix it with the rods. So this is about the lumbar disc prolapse. Same principle is followed if there is a disc prolapse in the cervical region also. So cervical region also most commonly it is C5, C6 and C6, C7 disc gets prolapsed. Upper disc normally doesn't get prolapsed. It's only the lower disc gets prolapsed. But in rare cases you can see upper disc is also prolapsed. There also you remove the disc and put an artificial disc. Again you fix it with the plate and screw from the anterior side, from the front. Whereas lumbar disc is operated from the back portion. You enter from here and remove the disc and then pass the screw and then place the rods and fix it. Whereas in the cervical disc prolapse, you operate from the front side. Incision is taken over the neck, reach up to here and remove the disc and place a artificial disc and put a plate and put the screw in the above vertebra as well as the lower vertebra and make fix it completely. So this is the idea of lumbar disc prolapse and the cervical disc prolapse and how to treat it.